way across the economic landscape in all kinds of different sectors and industries. Now we're going to talk about its application in the medical sector. Doctors are getting some help. A new artificial intelligence tool allows doctors to record patient visits and automatically transform them into clinical notes and summaries. We're talking about Suki AI. It says its technology will help reduce doctors' administrative workloads and instead prioritize meaningful connections with patients. Let's bring in the Chief Executive Officer of Suki AI, Punit Soni. Punit, thank you very much for joining us. Talk to us about the tool. The tool is called Suki Assistant. I think we've seen some graphics of it on a smartphone. Tell us how a doctor would use this tool.
Well, first of all, it's a pleasure to be here. Thank you for having me. The assistant, it's an AI assistant for doctors. And just to give you a little bit of background, in my opinion, the biggest public health crisis in the country, in almost all countries, is actually the access to doctors and the fact that there is a huge clinician burnout that's going on. 88% of all doctors don't even recommend their profession to their kids at this point of time because of the amount of administrative work they have to do on top of the clinical work they have to do. So AI is a good solution here. If you have an AI assistant, think of it like a simple app on your phone, but it's an assistant who's listening in and trying to help you. It could answer questions for you as you actually go, talk to the patient. It could listen to the conversation between you and the patient and create an accurate clinical note, and then push it into the underlying medical record system automatically so that you can focus on what matters, which is clinical care, and the assistant can do all the other work for you. So that's basically the premise, and I would say the underlying speech recognition systems, large language models, and NLP algorithms have now gotten sophisticated enough that we can guarantee this works with a very high degree of precision and accuracy across 30 plus specialties at this point in time.
That was my next question. Accuracy is so important in medicine and in a conversation about a patient's health. What kind of results have you had on accuracy? How have you been able to measure it?
Yeah, no, great question. A lot of people ask me, are you viable? How does this work? I said, well, we are deployed in 250 plus health systems across the United States at this point of time. We are actually deployed across, we started with 30 plus specialties, but at this point of time, the spectrum of specialties we are deployed in is about 100 plus. In the time that I'm spending talking to you, there's going to be about 20 patient encounters across the United States across different specialties, which will be using Suki in the room to do clinical documentation. So the first marker of accuracy is the fact that we just exist and it works and people use it. The second marker is that the AI will provide suggestions, and the doctors will then accept those suggestions as a part of their clinical documentation note. Our suggestion accuracy is as high as 92%, which means that 92% of the time when the AI will suggest a part of the history or suggest diagnosis as a part of the note or suggest comments under them, the doctor can review and accept it as is without having to edit or modify any aspect of it. So it's really, really getting super accurate. But at the end of the day, it's still an assistant, and its job is to provide information to the doctor so that they can focus on clinical care.
Who are your customers? Individual doctors or healthcare organizations?
It's interesting. It's across the spectrum at this point of time. Our focus has always been small, mid-sized, and large health systems, and that's where we have actually spent most of our energy on. Having said that, we have a pretty significant, about 15 to 20% of our business, that's basically small clinics, independent doctors who will reach out to Suki.ai, download or get access to the app, get a 2-week free trial. If they like it, they use it. But if you look at large health systems, we are deployed across, a lot of systems in the country, all the way from places like Ascension and, Rush, which we just announced recently yesterday, and so on and so forth.
It wasn't that long ago that doctors were actually keeping paper files in gigantic rows of filing cabinets. There were these big cranks that they would turn on the side of the filing cabinet to move it, move one shelf of files away from another. Finally, when I go to the doctor over the past 5, 6, 7 years, they are actually looking at my records on a screen in the examination room. To what degree is Suki Assistant integrated with other electronic health record organizations or systems?
It's a wonderful question. You know, the truth is that the past, where people used to have paper records, even though it was super painful from a data management perspective, was actually still relevant and useful for a doctor. They had to basically document a particular amount of things. They had information at their fingertips. They could work with it. Then electronic medical records and all of the related technology came about. The promise of technology that things would be available to them as they want at any point of time became real. However, it created a whole host of regulatory burden. It created a whole host of administrative burden and things that they had to do. And we end up in this world where they're spending time checking boxes, clicking things, when they should be actually looking at us and basically focusing on clinical care. So the promise of AI is that it should be able to bring us back from an experiential perspective to the days of the past where the doctors could look at you in the eye and actually take care of you, while the AI would do all the work that has to be done to actually make sure that this happens. So that's the promise of the product.
We are out of time, unfortunately. I'd love to ask you a couple more questions, but I'm told we've got to go. Puneet Sani, thank you very much. He's the Chief Executive Officer of Suki AI, a new tool for doctors that provides artificial intelligence support to their conversations with patients. Coming up, we'll get the pulse on the oil market.